My name is Donald Hoffman. I'm here to tell everybody about a new surgical technique that was used on me called the TAVR method. If someone came to me and asked me if I could recommend the TAVR method, I would say yes, definitely do it. It's a very low anxiety experience. My team of doctors were excellent. They gave me so much confidence and faith in the procedure that I think anybody'd be foolish not to do it. I learned of my condition primarily through regular checkups with my doctor, and they discovered this heart murmur. So they began to do echocardiograms, stress tests, and this went on for a period of 5 or 6 years. They were in no hurry, but they said, when we think it's time, we'll do something. And thank God they waited, because this TAVR method developed during the time that I was waiting to have open heart chest surgery. So my lifestyle hasn't changed at all post procedures. I feel fine. I have not had any pain. I have not had any regrets at all about having the process done.
I'm very passionate about what I do for the structural heart program because every time I encounter a patient, I realize that that's someone's loved one. And so if you keep that into perspective, you realize that you're dealing with, an individual, a human, right? It's not just another patient, and it's just not another name. So patients often tell me, stories about their life, stories about situations that they're in. And specifically when I met Donald, he and his wife both came to the initial office visit with me, and his wife said, "Donald's gonna die if you don't help us." Every day he leaves in the morning and takes off in his truck, and she's like, the thought occurs to me that I'm not gonna see him again. She's like, "Do you understand how sick he is?" And I was like, "Yes, I do understand, and we're gonna get this valve fixed as soon as possible."
I think he had a great outcome and has a kind of a new lease on life going forward, and has done a lot of exciting things, I think, over the past year, and has big plans with his, I think, Cowboy Museum that he's working on. And so that's been exciting to see, what people do after their new lease, that they get their next chapter of life.
I love living in a small community, and everybody that's here loves living in a small community. So what you get at New Braunfels, what you get at CHRISTUS Santa Rosa Hospital, is a boutique cardiac surgery experience. So we don't do 2,000 cases a year. If you want that, you go to Houston or Austin or Dallas. What you get here is a team of world-class people that have been at the high volume centers before, but now we all want to live in a small community, take care of one patient at a time. Yeah, we sometimes do more than one procedure a day, but we take care of one patient at a time, and we all love doing that.
Our team always has the patient's best interest at heart. There are no egos that get in the way. We are a small community. We live amongst all our patients. Their well-being is our priority. You often don't get this degree of collegiality and collaboration at these bigger medical centers with so many different providers and so many different doctors on the team. And I think that's what really makes our hospital and our program so unique and special.
This TAVR method has extended my active life. I'm 85 years old, going to be 86, and I still have some dreams that I want to accomplish. I'm trying to build a museum to the American cowboy in Nixon for the entire area, and it's going to be called Birthplace of the American Cowboy. It's going to have 14 sections in it, one for each particular historical period of our area, and I cannot wait for tomorrow to get here, because I've got something exciting that I'm going to do. I would say that without the TAVR method, I probably wouldn't be here talking to y'all.